Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Here's what I bring to you from the world of medicine. Ketogenic diet could potentially delay the onset of memory loss, find study. A new study published in the journal Nature Communications Biology utilized a mouse model to reveal that ketogenic diet postponed the onset of Alzheimer's disease and is credited with a 7-fold increase in the mice level of the beta-hydroxybutyrate molecule. Alzheimer's disease, a progressive neurodegenerative disorder, involves cognitive deficit and synaptic dysfunction. Beta-hydroxybutyrate has shown promise in delaying mild cognitive dementia onset. This molecule, produced during fat metabolism in humans, aids energy transfer from the liver when glucose is low. Research has suggested that BHB has anti-inflammatory effects on brain cells inflamed by beta-amyloid plaques. In the study, researchers involved genetically modified APP-PS1 mice who express a mouse-human amyloid precursor protein as well as mutant human presenilin-1 gene, both target central nervous system neurons. The mice were bred. Their female and male offspring lived in a 12-hour light and 12-hour dark environment with up to 4 mice in cage eating a standard mouse jaw diet for 6 months. At that age, they were assigned to weight balance group, with each mouse living in a separate enclosure for the remainder of the study, so researchers could control their consumption of food. Mice were given either a keto diet or a carbohydrate-rich standard diet. Both diets provided the same number of calories.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possess in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
People at higher genetic risk of obesity requires increased workout intensity study. According to a study conducted at the Vanderbilt University Medical Center and published in the JAMA Network Open, individuals with a higher genetic risk of obesity needs to work out harder than those of moderate or low genetic risk to avoid becoming obese. Individuals with a higher genetic predisposition to obesity may find that they need to put in more efforts during workouts to achieve similar results because genetic factors can influence their metabolism, fat storage, and energy expenditure, making it more challenging to maintain a healthy weight through exercise alone. Physical activity guidelines do not account for individual differences. Genetic background contribute to the amount of physical activity needed to mitigate obesity. The higher the genetic risk, the more steps needed per day, said senior author Douglas Rutherford, PhD, Associate Professor of Medicine, Division of Genetic Medicine, and Director of the Center at Digital Genomic Medicine at the VUMC. The study included 3,124 middle-aged participants without obesity who owned a Fitbit device and walked an average of 8,326 steps per day for a median of more than 5 years. The data revealed that the incidence of obesity over the study period increased from 13% to 43% in the lowest and the highest polygenic risk score groups. Individuals with a polygenic risk score in the 75th percentile were required to walk an average of 2,280 more steps per day than those in the 50th percentile to have a comparable risk of obesity. People with a baseline BMI of 22, 24, 26, and 28 who were in the 75th percentile of polygenic risk score were required to walk an additional 3,460, 4,430, 5,380, and 6,350 steps per day respectively to have a comparable risk of obesity to persons in the 25th percentile. Could delirium be a strong factor for dementia? A study published in the journal The BMJ found that delirium is a strong risk factor for dementia and death among older people and has a strong independent effect in this clinical population. Delirium is a sudden change in person's usual mental state. Symptoms include agitation, confusion, or being unable to stay focused when awake. Delirium is much more common in hospital patients and older people. Previous observational studies have suggested an association between delirium and subsequent dementia, but the relationship remains unclear. For the study, research in Australia analyzed data from 6,26,467 patients aged 65 years and older with no dementia diagnosis who were admitted to hospital before January 2009 and December 2014. Of these patients, 55,211 had at least one recorded episode of delirium and were matched to another 55,211 patients without delirium by age, sex, frailty, reason for being in hospital, length of stay in hospital, and length of stay in the intensive care unit. These 1,10,422 patients were then followed up for 5 years to see how many of them were diagnosed with dementia. Collectively, 58% of patients died and 17% had a newly reported dementia diagnosis over the follow-up period. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.